Focus of today's briefing will be on children in the school setting. Administrators and families are preparing themselves for the certainty that COVID-19 cases will be found in schools. Our local schools have developed plans to lessen the chance of COVID-19 exposure to students, teachers, and staff while in the school setting. However, COVID-19 is still spreading in our community, and our schools will not be immune.
Okay, next we'll hear from Janet Hill with Rock Island County Health Department on children in the school setting during the COVID pandemic.
So we are assuming that there will be outbreaks in schools. So right now we are encouraging all families with school-age children to plan ahead for how they will handle child care, work, and other duties if their child becomes excluded from school because they are found to have COVID-19 or are told that their child has been a close contact to an individual with COVID-19. Right now, families are encouraged to talk with their employer about policies that are in place if they need to be away from work to take care of their child. We also want them, they should also find someone else who can take care of their child during this time and to make sure that this individual is not at high risk of severe illness should they get COVID-19. This includes people who are older, who have pre-existing health conditions, etc. We want them to plan for how they will meet their household needs during this time, including grocery shopping and using curbside pickup for delivery and pharmacy trips. And we also want them to think about the following scenarios related to COVID-19, which would require a child to be out of school for a set time period. If your child tests positive for COVID-19 or has symptoms of COVID-19, the child will need to stay home for a minimum of 10 days. If your child has been exposed or is a close contact with someone with COVID-19, either in the school setting or from someplace outside of the school, the child will need to stay home for a period of 14 days. School is not the only setting where children will be in contact with others outside of their household and therefore at risk for COVID-19. Families have lives outside of school as well. We encourage families to take a look at the activities they participate in outside of the school setting. We all enjoy family gatherings, slumber parties, outdoor barbecues with neighbors, but these types of activities increase the risk of being exposed to COVID-19 because it takes anywhere between 2 and 14 days before someone develops symptoms or even knows that he or she has COVID-19. A child could unknowingly bring the virus to school and expose others. Beyond staying at home with members of your household only, there are hardly any activities that have no COVID risk. So please just be careful as to which activities you and your families participate in. We encourage everyone in our community to support our schools and extend them grace during these challenging times. Our school administrators and staff have invested countless hours and work time to be prepared to respond to endless numbers of scenarios related to COVID-19 that could come their way. Please know that both the Rock Island and Scott County Health Departments will support our local schools and their families every step of the way. Please do your part. Talk with your children about the importance of precautions schools are putting in place, such as wearing masks and distancing of students while in the school setting. Have them practice wearing masks for times longer than just a couple hours. Don't wait until the first day of in-person school. Explain to them the importance of hand washing and covering their coughs. And please make sure you keep your children home when they show signs of illness. We know this isn't what we had hoped for the start of the school year. My sweet little niece started kindergarten this week. Her mom took the requisite first day of school photo outside, and they went to the kitchen table to log into her Zoom lesson. That's not how it's supposed to be. It's okay to mourn what should have been. It's not okay to ignore our reality and forge ahead like nothing has changed. Our kids take our cues from us. Please help them adapt, both physically and mentally. Grace and compassion will go a long way to making this scary time a little easier.
Thank you both, Janet and Ed. Next, we're going to hear from Dr. Daniel Arnold with Unity Point Health Trinity. Please go ahead, Dr. Arnold. Oh, can you unmute yourself?
There we go. So
okay, you're good.
Yeah, excellent. So I've been asked to discuss a couple topics or questions as far as what we're doing from our standpoint. So one of the questions that we have here is, what symptoms are we seeing in kids with COVID? I said we haven't seen a rash of them. I've seen a couple teenagers, but not tons and tons of kids. Really, so far we're seeing people who are exposed and then test positive. But what we do see, things like fever, cough, sore throat, upset stomach or diarrhea. And one that we're seeing in teenagers is loss of taste and smell. That one there seems to be relatively specific for COVID. Another topic I was asked to talk about is some tips for parents. Tips for parents who suspect that their kids may have COVID-19. One is contact your primary care provider if you have one. See what their recommendations are. They may want that child to be tested, especially if there's symptoms present. Let's see here. Other things for the parents is discuss early on tips with your kids to do things to help stop the spread of COVID, because in a lot of times this is an asymptomatic infection in kids. You almost have to assume all the time that everybody has COVID. So you need to do the social distancing of 6 feet. You need to be hand washing. That's something that even as healthcare professionals, we need to be vigilant about. If you touch your mask, if you cough or sneeze, you need to be reaching for that hand sanitizer. Let's see here, what else? Things that providers are doing for flu and COVID season. One of the things we're doing is really encouraging flu shots this year. One of the issues we have is we really don't have any experience whatsoever what it's going to look like if you have a co-infection with flu and COVID. So because we don't know what that's going to look like, one of our strongest weapons right now is going to be getting those flu shots so that we hopefully don't have to deal with a co-infection of flu and COVID. So we really want those flu shots to be really given this year, even more than most years. Another question here is because we have COVID-19 and flu in the same season this year, what can we expect? If there's a silver lining to this whole scenario, a lot of the things that we have in place for COVID-19 are the same things that we should have in place to help reduce the influence of flu for the year. So hand washing, social distancing. If you're sick, stay home. These are things that in a flu season we may or may not be great at doing, but because we have COVID-19 in place this year, we're more likely to do these things. Wearing a mask may have a large impact in whether flu is transmitted this year. So best case scenario, if we do a great job of helping to prevent COVID, we may get lucky and have a light flu season. I'm really hoping that's the case.